IVF means in vitro fertilizations. It's a Greek word. That means fertilizations outside of the body. So it is mainly indicated when it is not possible inside of the body. Two types of the patients where IVF is indicated. In the female point of view, we will say if there is no egg formations or there is no growing of the eggs, or we can say there is a multiple IUI failure, or we can say the polycystic ovaries, or we can say the severe grade 4 endometriosis. And last not for the least, first indication of IVF in female is bilateral tubal block. These are the indications for IVF in the female. For the male point of view, less than 5 million count, 0 count, 0% motility, and we can say morphology is bad, means less than 4% of the sperms are good, right? This is the reason for the male where it required a IVF. Here we are seeing only that our center is the referral center for the failures. That means those who has been advised for the donors in male or female. As for example, is female is advised for the egg donor or male is advised for the sperm donor in respective to their counts, in respective to their reports. We are the first IVF lab, or we can say only one IVF lab, and the center which commit to give own egg, own sperm pregnancy by some different protocols with the high-end laboratory supports. Wings IVF Hospital is having a very high-end facilities for the IVF lab, and as far as concerned the clinical part of the requirement of the IVF patients. For the clinical part of the IVF patients, we are having a 4D sonography for the detection of the uterine and ovarian pathology and the follicular studies. We are having a very high-end cloud-based system where people can know their all the data and they can know their all the reports in the cloud system. As far as concerned the IVF lab, Wings is having a very high-end 0.3 micron IVF lab. It's a clean 0.3 micron IVF lab where the quality of the air is very high. Instrumentations, we are having a time-lapse technique like embryoscope, where we can say where the embryos is lacking to give results. It will increase the results, it will decrease the abortion rates, and it will give more blastocysts the 5th day embryo. We are also having all the facilities which will like to improve the IVF outcomes in our lab. You can see all the facilities at our website, and we are secondly saying that we are the center where the failures should be having more focus. That means we are as much eminent and prominent in our IVF market that we are having experience, we are having a high-end all the instrumentations for all the IVF failures. So we are committed and challenging to the failures, those who failed more than 2 times at your center. We are having very high-end instrumentations in the IVF. We also have a cryopreservation technique in which we are having slow freezing and vitrifications. But as far as concerned, 99% we are doing blastocyst vitrifications, where we are committed to give a results more than 55% in a normal natural cycle. For the IVF, everybody is interested. At the end of the day, it is only results. Results only matters. And that's why we are more focused on the outcome of the patients, especially 9-month carry home pregnancy. That is one of the most important outcome in the IVF. I, Dr. Jayesh Amin, telling about the results that the self-patient in Wings Hospital, the success rate is according to age. Less than 30 years of the age, we offer by the self-gamete 65% of the rate of results. We offer 50 to 55% results in 30 to 35 years of the age, and we offer in 35 to 40 years of the patients, 35 to 40% results. More than 40 years of the age of the patients, we offer 10% results. IVF is also indicated that what already we have discussed in egg donation program. Our center is scientifically committed to give more than 90% results when the age of the recipient will less than 35 years of the age. If the age of the recipient is more than 40, in that condition even we offer a 75% of the outcomes in single cycle in egg donor program. For surrogacy, people are always oriented to the outcome in minimum attempts. We are committed and challenging to give a 95 to 99% results in a single cycle in IVF surrogate patients. What are the good IVF centers identity? As far as concerned the IVF center, we are saying that you should be having a 0.3 micron Ivf Lab. This is the very good air quality, highly pressurized IVF lab. Second, IVF lab should have an in-house embryologist. Third, the IVF lab should have time-lapse technique like that all the high-end incubators that we have. These all things with the combination of the clinician very good induction protocol will give a very good results. In our IVF center, in 99% of the cases, we are only transfer blastocyst 5th day embryo, and we are having a high-end facility of vitrifications of blastocyst 5th day. We are only freezed blastocyst vitrifications. As far as concerned accreditations, our IVF lab is accredited with the Orizio, Sweden. Challenging and giving results in IVF. We are committed. I myself, Dr. Jayesh Amin, we commit to those people, those who are failed to conceive by 2 or 3 IVF cycles at other center. We commit to challenge those young couple where they are advised to go for egg donations, sperm donations, where we are committed to give a pregnancy by their own eggs and own sperms. We commit to the people, those who are having a recurrent IVF failure, where we advise PGS, PGD and Arine at our centers. And we commit to all the IVF failure patients to transfer only blastocyst and vitrified blastocyst at our centers. Especially our aim is to transfer very less embryo, 1 or 2 blastocyst, and freezing of the blastocyst by vitrification techniques. Wings IVF Center will dedicatedly committed to the male infertility. We are providing the detailed sperm morphology. We are doing CASA. We are doing high resolutions injections of the sperm injections inside the eggs in ICSI procedure in IVF. We are doing a sperm vitality test. We are doing the DNA fragmentation test. So we are having all high-end lab requirements for a male infertility. We are transfer only blastocyst in a male infertility dominated cases. As far as concerned the male infertility, we are having an in-house sonography for testis, transrectal ultrasonography, the high-end opinion by a endocrinologist, and we are also having a facility for micro-TESA, micro-PESA. These are the micro techniques where we are committed to give their own pregnancy in case of azoospermia, oligospermia, severe asthenospermia, 0% count and 0% motility. Egg donations is required in a female following cases. First, congenitally absent of the ovary. Second, primary ovarian failure where the ovaries fail to produce the eggs. Third, a secondary ovarian failure, maybe it is because of the surgical removal of the ovary or because of the perimenopausal or menopausal women, where the egg quality and quantity, it tends to zero. In our centers, we are having a highly educated donor profile where we can give all the history detailing of the donor before transferring the embryo and choosing a very good high-end selection of the cases in the egg donation cycle. So what is the difference between the egg donation cycles at other centers and at our centers? That is what we are telling, that we are having a highly good profile egg donors that we are committed to give before your transfer of the embryo inside your womb. That we are giving all the details of the donor first. Second, we are always transfer blastocyst in a donor. Third, we are committed to give more than 90% results as far as concerned our data in the donor cycles. That's why we can say that our center is very high-end facility for the donor cycles. Yes, we know that surrogacy means keeping the embryo in a non-genetic mother. That is called a surrogate mother. We are having a long list of surrogate mother with having all the international criteria, filling all the congenital disease. Yes, surrogacy is a separate department in the Wings Hospital. It has got international surrogacy department, and it is also got Wings are having a separate surrogacy department in which we are having international surrogacy department and the national surrogacy department. We are also having ICMR number with we are having all the import expert number for the international surrogacy. For the international surrogacy and the national surrogacy, we are having a surrogate mother list which all are going to be have all the investigations, blood investigation, the congenital disease, all the list we are always in ready. And these are the selected surrogate mother where they are confirmed to get implantations by our implantations test. So for the international surrogates patients, we are having a separate page on our website where we are requested to say something our main intention is only minimum visit, minimum stay, all the facilities where the surrogate mother is required, it is in-house, and all the legal part will be very much confirmed and deeply specialized, that what we are transferring to all the international patients. Thank you.